I'm Oona Hanson. I write the Parenting Without Diet Culture newsletter here on Substack, and I'm so excited to have our special guest today, Julie Duffy Dillon. Um, and today's conversation was inspired by a reader question that I got. I'm starting a new Ask Oona column essentially, and I realized for this question, I really needed to phone a friend. And because the question was about PCOS, I knew just who to call. So I'm so glad Julie's here. I'll let her introduce herself, and then we'll dive into this reader question. So yeah, Julie, tell everyone about you in case they don't already know your work.
Yes. Hey, thank you so much, Una, for first of all, for inviting me on. And my name is Julie Duffy Dillon. I'm a dietitian and a PCOS expert. I'm the author of the book Find Your Food Voice, and I have the Substack. It's PCOS Health with Intuitive Eating. I've specialized in the last 25-ish years on helping PCOS, people with PCOS in particular, to repair their relationship with food. So um, I didn't really want to specialize in PCOS, but I was really into food behavior, and people with PCOS just kept showing up. And I'm like, we need to help find ways that aren't another rigid diet to promote health and so you have energy and you can enjoy food too. And of course, so many people have asked me the question about what if my kids get PCOS? And that's something that is really important. I love talking about. So I'm excited for this topic today.
Great. Well, thanks again for being here. Yeah, so this reader wrote in a question. I'm going to read it out loud. And the question itself, maybe we can even unpack the question.
Yes.
So the question is, I have a question about a medical need for weight loss. My 18-year-old may have PCOS. There seems to be a strong correlation between weight, diet, and PCOS, and ultimately fertility. Any tips on how to talk about this? So there's a lot to unpack.
I know. Let's start.
Well, one thing I thought we'd start with is some folks might not be 100% sure what PCOS means, especially because the name I think can be a little bit confusing. So could you just start by telling us what is PCOS?
Yeah. So PCOS, or polycystic ovary syndrome, is actually an endocrine disorder that starts in the brain and not in the ovaries. And it's something that impacts 1 out of 7 women or people with uteruses. And it's been around, or it was discovered about 100 years ago, but we don't actually have that much research on it. And unfortunately, it's become one of those conditions that is hard to diagnose. Most people don't ever get diagnosed, even though they have it. And it's lumped into the category of, well, just lose weight and it'll make it go away. So that's why I was working with so many clients with PCOS and eating disorders, is because they tried for so long to do what their doctor was telling them. And my clients were I wrote about someone named Matilda in my book, who was someone with PCOS who did everything that their doctor told them to do and still was gaining weight and still had symptoms of PCOS and just felt so blamed for the condition, but and also ashamed that they couldn't make it better. And PCOS is something that it does impact the ovaries, but it also impacts the metabolic system. So there's high cholesterol, insulin resistance, high risk of diabetes, and it also has psychological consequences to it because it starts in the brain. So mood disorders like depression and anxiety and bipolar disorder are all really common too. Of course, there are reproductive consequences. It is the number one cause of anovulatory infertility. But yeah, it's just something that basically ends up impacting every cell of the body with PCOS. And it's something that people usually don't discover until they're in their 20s, but it's something that they have their whole life. It doesn't go away once they stop menstruating. So it can be complicated, especially if you are a parent like this person and you see the road ahead and you're like, I just want to help them to not have to deal with body shaming. Maybe they're also thinking about their fertility. And so, yeah, it could be really hard and wanting to make sure that their child is healthy.
Yeah, thanks for explaining that. So basically, you are born with this and you have it your
Mhm.
whole life. And so it becomes about managing symptoms and supporting your overall well being. We probably won't get into the fertility piece too much today,
Right.
but obviously that's a big thing on people's minds. So let's start with why this parent is assuming that weight loss is the solution or is the
Mhm.
treatment for PCOS. Like this mom is not getting this idea out of thin air. Could you talk about where that assumption comes that that's like a treatment for PCOS?
Well, it is like when you read PCOS research and they do these evidence-based guidelines every 5 years, it says in there that lifestyle interventions are the number one intervention for PCOS, even though those guidelines also state there are no diet interventions that have been found to actually help people promote health with PCOS long term. So they're kind of like just pick any diet. And for people I've worked with over the years, they were either told directly like your weight gain caused PCOS, or what you ate the wrong things, or you didn't exercise enough, or they're kind of just led to believe that because for many people, weight gain came before their diagnosis. And for some people, it's a little bit, some people don't gain any weight. You can be any size. But there's certainly a significant amount of people with PCOS that gain a tremendous amount of weight really quickly. And so it's easy to kind of be like, well, that must have caused it. And so, if someone thinks that the weight gain caused it, then they're going to apply the opposite, like, well, losing weight will cure it. And, I could spend probably a semester worth of time talking about the weight science in PCOS. We don't have time for that. But the thing to keep in mind is PCOS is not caused by weight gain, and there are no interventions currently that we have. Like we have no diets currently that actually have been shown to promote health long term with PCOS or for anyone really. So it can't be the cure. But doctors are still telling people this every day that this is the only way. And I mean, I feel like my job on this earth is to tell people, no, there are other ways to manage your PCOS without trying another diet.
Yeah, and I can imagine because it seems like onset can happen around that sort of early adulthood.
Mhm.
I mean, maybe I have that wrong, but it seems like that's a
Right.
common, um, and it can kind of overlap where people think this is like the so-called freshman 15, or they think their child is like eating the wrong things in college, if that's where, kind of where that young adult is. Could you talk a little bit more about why this age group and kind of the vulnerabilities that they have for things like body image concerns, eating disorders, et cetera.
Yeah. So there's so much to unpack because yeah, it's really common to get diagnosed in your 20s with PCOS. And for many people, that's when they're leaving the home for the first time, whether it's for college or they're getting their own place. And so it can be really stressful, right? To like go through this huge kind of leap. And we don't know exactly what causes PCOS. We know it's complicated, right? Like just many other things. It's definitely passed down through families, but there's something about stress, trauma, some environmental triggers that seem to be the trigger for PCOS symptoms to start. And I don't know if you know this about me, Una, but I think it was 10 years ago, I was on a reality show with someone who had PCOS. It's My Big Fat Fabulous Life. And Whitney is the main character on there. And I was her dietitian, and she has PCOS. And what she talked about in the show is how she gained, I think it was between 50 and 100 pounds her freshman year in college. And that was something I heard very, very frequently. And then, of course, she was blamed for it and all that. But really, when it comes down to it, for many people with PCOS, it's just part of the natural transition of the disease. And because it's kind of this diagnosis of exclusion, everyone has, there's like different presentations, right? And the most common presentation is when someone has very high insulin levels, along with high androgens and irregular periods. So when someone has all of those together, it often leads to weight gain for many people. And so, um, when you're in your early 20s, you're finishing puberty, things are still changing, you're doing all these life changes. And so body image is already stressful. Like change is hard on so many things with our psychology, including our body image. And so this person who asked the question, I'm like, oh my gosh, I would love to sit down with you because this is a really important like part of this young person's life to impact their own body image for the rest of their life because their body's going to continue to change and society may not always give them like acceptance because of that change, but it's just a part of being a human, right? And it won't always change as quickly as it is right now, but just to maybe like basically learning that lesson, like none of us are going to stay the exact same, you know? And I think about this young person's future children too, if they decide that they want to have a family, to be able to pass that on too. Like, hey, you're acceptable no matter what size you are. And that's something that Whitney and in that TV show, she really was very vulnerable in sharing is like how the world reacted differently to her based on her body size. And I'm assuming that's what this person has experienced. It's probably what this parent also is struggling with is just knowing that that can happen. And that in itself is the stress that I think about as a clinician just will make insulin and inflammation levels go higher and make PCOS symptoms worse. So I'm all about like, how can we lower insulin and inflammation to help manage those symptoms? And for this parent, that's one of the best things you can do is communicate like, hey, I love you no matter what. Like, no matter what, period.
Yeah, that's really powerful. I think for all of these uncomfortable body image moments for parents, where I think the message diet culture gives us as parents is that, oh, if my child doesn't like their body, I should be there to help them so-called fix their body.
Oh, yeah.
And that's the loving thing to do. And I think
Mm,
obviously with the work that you do and the work that I do, we've seen that, it's tempting, right, to take that approach. That's what the culture is telling us, but
mhm,
that it actually is counterproductive um, to our child's body image to feel like, oh, it's so something is so wrong with them that like my mom or dad has to like do something drastic, and that my mom and dad agree with, or parent or guardian,
mhm.
you know, are sort of agreeing with the cultural headwinds,
Yeah.
um, and that actually might be making someone's symptoms worse too. That the stress of
Yeah.
that, yeah, that's really interesting. So going back to the diagnostic piece, is there anything a parent should know that they should be asking about as they're navigating a diagnosis for a teenager or young adult child?
Yeah, I would be asking the doctor, how did you diagnose this PCOS? Because um, oftentimes people aren't really sure why they got the diagnosis. And sometimes, I mean, I'm this is where I'm like, I'm only a dietitian, but sometimes I don't agree with doctors when they diagnose PCOS, or sometimes they think someone doesn't have it when I think they do. And so sometimes you may want to get a second opinion. And one of the best things you can do is learn about something called the Rotterdam criteria. That's the criteria that we currently use to diagnose PCOS. And in order to get diagnosed with it, a person needs to meet two out of the three. And honestly, you don't even need lab work to get the diagnosis, but I know if this was my child, I probably would want lab work just so I would have like extra kind of concrete information. But the three criteria are irregular or absent ovulation. So your child may have really irregular periods, but of course, I mean, I have a teenager at home that menstruates. Like irregular periods are pretty normal, right? And so that's the other thing I wanted to mention is this parent may want to also ask, like, are you sure that they have PCOS? Because you really can't technically diagnose PCOS until someone has been menstruating for 7 years because of that really common irregular component. Now, that can change because there is some new research being studied right now on like lab work, like different lab work that can be added to the diagnostic piece. But then the other criteria, the Rotterdam criteria, going back to that, the other one is high androgen, so like high testosterone levels. And sometimes a person can get lab work to like show that, or you can sometimes just have like a physical exam, or if someone has more facial hair than they're expecting, or androgenic alopecia, or hair loss in their head, that can even just be a way to diagnose it too. And then the third is evidence of multiple immature follicles on the ovaries with an ultrasound. And notice I didn't say cysts. I always feel like that's kind of like the trivial pursuit question. You don't have to have actually you don't have like cysts on your ovaries. These are just immature follicles, and so they named it wrong. but
Mhm.
uh, but you don't even have to have those to have PCOS. And I always like to say that because someone watching right now was told at some point that they had PCOS, and then another doctor said, "No, you don't because you don't have cysts on your ovaries, and you don't have to have them." So, I don't know. I just think it's good to make sure that you have a really great, like, clinician diagnosing to make sure that actually it is accurate, and it is kind of this ambiguous condition, right? Like, we don't it's not black and white. So, I would expect this young person and this parent to be kind of like, I'm not sure if they have PCOS, and that may be for a couple years.
That's interesting.
Hmm.
And in terms of the medical provider who would be making these diagnoses, generally, would it be an endocrinologist?
It can honestly be any healthcare
Okay.
provider that's like it could be an MD, an nurse practitioner, a PA. I honestly am like, whichever healthcare provider that can diagnose, that is the nicest to you. What is who I would want to go to, and also has some competency in PCOS. But OBGYNs are really common folks to diagnose it just because they are working with so many people who are menstruating. And endocrinologists can be really great, like diagnosticians. Um, but I have, like in my local area, there are a couple PAs that are fabulous that I think are the best in my area. So, you know, it kind of just depends. Yeah.
Yeah, so it sounds like the name, excuse me, the name is a misnomer, right?
Yeah.
It's not actually accurate. Like, if you like could rewrite the diagnostic manual tomorrow, is there like a name you would have that you feel like captures this condition better?
Um, that's a really great question. No one's ever asked me that. I think it's important to really capture all of it. And I wish there was some way to address really the metabolic side of things without it being shaming about weight. Because I feel like the
Mhm.
even word metabolic syndrome has a lot of like weight shaming kind of connotation to it. I wish there was more like endocrine, like I feel like the word endocrine has some seriousness to it. And I say it like that because there's so little research on PCOS. We've known about it for 100 years, and we still don't have an FDA approved drug. So, there's lots of medications they throw at it, but there's no like actual medication for it. So yeah, I think some kind of metabolic endocrine syndrome, or I don't know. I wish there also could be a way to take the word syndrome off of it because
Mhm.
I think that also minimizes it. It is something
Mhm.
that for someone with PCOS, especially someone who's not getting the treatment they need, it can take over their life. Many of my clients are on disability. It impacts their whole life. And it's a condition that gets worse over time. So it gets worse. And people need support, but yet so many people don't understand it. So yeah, I wish they could just call it a disease or something so it would be categorized differently.
Yeah, and it sounds like it's perfect for sort of like diet and wellness culture
Yeah.
when there aren't good medications and the research kind of isn't there. And I have a theory about why we don't have enough research about this
I have
disease.
very, yeah.
Yeah. Um, Obviously, we know women's health is really underfunded, but yeah, it's interesting that or I should say, it's not surprising that diet and wellness messages are like just they're right there to fill in that gap.
Yeah.
Yeah. So, um, how about pivoting to what someone can do to take care of their health once they get this diagnosis that isn't necessarily with a goal of weight loss, or when that if that is ever appropriate
Mhm.
as a goal. I know you've already addressed that that's not
Yeah.
like there's no evidence that that like solves everything, but just
Right.
to kind of talk through what people's options might be.
Yeah, and I hope people appreciate they have options. And certainly there are some people, especially when they're young with PCOS, they may find weight loss like fixes their symptoms, but I mean, having the privilege of working with people for as long as I did, years and years, working with the same clients, I got to see how dieting eventually just stopped working. And I think it's because of the insulin resistance. And not everyone with PCOS has high insulin levels, but most will by the time they're in midlife. And so that would be the thing that I would really encourage, like this person who wrote in, um, is to help their child understand like what insulin is and how to help it long term. Okay, diets can do some things in the short term, like we've already established that. But long term, doing things like making sure you're eating enough, not skipping meals, what can you add to your day? I mean, I think to me, you don't need to take anything away to manage your PCOS. I just want to help people add tools that help. And there's some tools that help most people, and then there's some that just help a few people. And so I always like to start with the big ones. I encourage my with PCOS to add inositol. It's a supplement It's one that has over 10 years of research behind, and it goes into at the cellular level helping insulin receptors to actually get repaired because there's a defect or a deficiency of inositols with PCOS, and supplementing with it helps to lower insulin, it helps to lower androgens, and help with the metabolic side of PCOS as well as the reproductive consequences. It also helps the anxiety that I don't know if anyone listening has PCOS and anxiety, but there's something about anxiety and PCOS that just seems so different. I've lived with anxiety my whole life, so I feel really familiar with it. But my clients with PCOS, the way they describe anxiety, it sounds just so much harder to manage. And inositol is something that's helped a lot of my folks. And at the same time, if you're not eating enough, it won't do it. So you have to make sure you're not skipping meals. And then the other thing is with PCOS, you probably are going to be someone that's going to need more rest, more sleep, more boundaries. You're so many of my clients with PCOS were amazing caretakers and like CEOs at work. They were taking care of everyone and everything and like just like bosses. And at the same time, their insulin levels were really high. They were not sleeping well. And having to actually insert rest during the day could be like the most powerful thing for insulin levels. And so that's the other thing is like really making peace with like, you just may need more rest than your peers. And that's okay. And I don't think our world really celebrates that. I often say that I'm not built to like thrive in capitalism. I actually don't think most humans are. But I think when you have PCOS in particular, stress, trauma, um, not eating enough, just running yourself ragged, it's going to hurt you more, especially once you hit midlife, that if you can set some boundaries now and just learn how to do that, I think it'll help you long term so much. Um, and of course, I'm trying to think of another one. I had one other one that's just off my brain now, but it'll come back. But yeah, those are just to start with.
It's so interesting because you mentioned like the importance of not skipping meals and the importance of rest. And of course, if someone's walking out of a doctor's office with a prescription to lose weight, right? They're going to be thinking restricting and exercising.
Yeah.
And those, over exercising, I imagine, is not helpful for someone if it's adding stress. Could you talk about the exercise piece?
Yes, I would love to. I think the exercise piece is so complicated. And, working with people with eating disorders and PCOS, I got to see a lot of people go through recovery. And the food part was hard, but not as hard as the movement or exercise piece. And movement and exercise is definitely something that people with PCOS are told that they have to do. Like they have to exercise even when they're tired. They have to push harder. They have to exercise for hours and hours. And as a human being, I don't think you should have to do that. Like if you need rest, you need rest. But then also like clinically from a dietitian perspective, like seeing how intense overexercise impacts inflammation and insulin levels, no, it's just going to make PCOS worse. And
Mm.
so, what I noticed is as my clients were getting enough to eat, which is individual, right? Everyone has certain amounts to eat, but basically at least 3 meals a day and probably some snacks, getting enough rest, supplementing with inositol. Once that's happening for like 3 or 4 months, my clients would start to come into my office and say, Julie, I'm having this weird moment. I'm like craving exercise. I don't know what to do. And I'm like, and because it's complicated because they were just forced to exercise. And so that meant punishment. And for some people, they never really enjoyed movement because maybe they were just not invited in the groups to like do fun things on the playground, or they just never felt okay to do sports. And so it can be really a long process just to find movement that you enjoy. But basically what I've been able to read in the research and see with clients is it doesn't need to be intense. It doesn't have to be hours and hours. It's just kind of like consistent movement that feels good to you and probably is like what some people will call is like lower impact supports like helping with insulin and inflammation. Now, there's another side to this too, though, is because of the higher circulating androgen levels, there are a lot of people with PCOS that are amazing athletes. Like their muscles are stronger than maybe some of their peers. And I love that. I'm like, there's a perk. There's a perk to PCOS. And so for some people, they love exercise. They love intense stuff. They love running marathons. So if you're like that, that's okay. You just probably are going to need to eat a lot more than everybody else. Yeah. And just trying to find a way to be okay with that.
Good to know.
Yeah.
Um, so I know you've written about and talked about how some of the type 2 diabetes medications
Mhm.
may be helpful to some people with PCOS in terms of insulin and things like that. Could you talk a little bit about that?
Yeah, I did a really big deep dive because I've had a lot of experience working with GLP-1s when I was a diabetes educator, but that was 20 years ago. It's before it was like a weight
Mm.
loss drug, right? And I remember like it was so exciting to see, especially as I was hearing about it at conferences and how it really helped with insulin resistance. And so as it started to be, gaining traction again before it was a weight loss drug, I was really excited because I was like, this could be something for PCOS. And honestly, some of the research that's going on right now with PCOS and medication, there may be a PCOS medication that has a GLP-1 component to it. I don't know how I feel about it yet, but I did do some research, deep dives on GLP-1s and PCOS because I'm like, okay, so what if it changes weight? I want to know if it actually impacts health. And so I looked at triglycerides, cholesterol, androgens, fertility, and the it was mixed. There's not a lot of research. Most research in PCOS period is like this, but they're really small sample
Mm.
sizes. They're 6 weeks or 12 weeks long. They just don't have a lot of funding, of course, like we've been saying. But when I went through it, the one thing that seemed to be impacted in the research I was reading the most consistently was triglycerides. And if you have PCOS and you've never looked at your triglycerides, I would highly recommend it. Triglycerides often come with your cholesterol panel, but they're really connected to your blood sugar and your insulin levels. And so that's why it's really common to be high with PCOS. It's also a part of how eventually many people with PCOS get fatty liver disease. I think it's like 1 in 4 people will have it with PCOS. So GLP-1s, especially at a lower dose, you don't have to have the mega dose, can help. And then androgens, that was the other one that I saw consistently in research that GLP-1s were helping. Um, but it was GLP-1s impacted androgens the most when they were paired with metformin. And I think we sleep
Mm.
on metformin. A lot of people don't think it's sexy anymore, but metformin it's like $5 a month or free for most people in the US. So like this is accessible.
So that's why we don't hear about it because now that it's generic, no one's making money off it anymore.
All kinds of and they made extended release and all those things, but still, metformin, I know for a lot of people, they can't tolerate it, it tears up the stomach, but if you can tolerate it, it helps with androgens and insulin and blood sugar and triglycerides, and it even helps the microbiome, that's a sexy topic, right? So, I don't know, like, that's something to think about if you're like, "I wanna add a medication." My recommendation oftentimes is metformin, and the only thing I would say, and this is kind of like advanced PCOS, but let's do it, is make sure if you do use metformin, most people need a significant amount of it, like 1,500 to 2,000 milligrams. Now, certainly me as a dietitian on the internet and you, Una, we cannot prescribe any medication or tell someone how much to have. This is just for education, right? But yeah, just like make sure your doctor knows about. You need to have probably more metformin than people with pre-diabetes or diabetes because there's just so much insulin with PCOS compared to people without PCOS. So yeah, I hope that answers your GLP-1
Mm.
question.
Yeah, that's great to know. So, anything else you think a concerned parent should know about PCOS, about
Mhm.
kind of what their role is in helping their child either navigate diagnosis or navigate treatment?
I I think it's really important to teach our children, whether they have PCOS or not, but especially with PCOS, how to advocate for themselves at the doctor and just in navigating the healthcare space because there's so little information. There's lots of stigma associated with the condition, especially if someone's in a higher weight body. And so teaching your kid like how to navigate those questions, if a doctor's like, well, you just need to eat less carbs or you just need to put the
Mm.
fork down or whatever shamey kind of thing that this doctor will say to have some just I don't know, like, I like to teach my kids, like, some one-liners way back. We can practice. And so for some of my clients, they would say, "Hey, listen, doctor, I've tried every diet you can imagine. Can you give me another option? Any medications, any supplements?" Or you could even say, like, "I would love to hear what you tell your thin clients with PCOS." Or, "Hey, listen, I'm in recovery from an eating disorder. Going on another diet literally could kill me. What else do you have for me?" Or you could even be like, "I've read some research. What about this?" And I just need to name though, like it stinks that a child or I mean any human being has to advocate at the doctor like this, right? Like you shouldn't have to do that. But certainly with PCOS, it's a really it's just part of the condition. And so the other part I would say for this parent and this young person is try to find other people who have PCOS because you all can strategize together. You can pool resources. You could say, like, avoid this doctor, go to this clinician. Hey, there's an esthetician I know that does really great with skincare. Do things like that because then you can support each other and have community and really again, I always think about insulin and inflammation. Like it goes back to that. Like that's something that's going to help those two things more than cutting out any food, right?
Oh, that's so helpful. Yeah, it feels like it's really about that, like, self-care, not
Yeah.
self-control, right? The way that,
Yes. Yeah.
we're often told to, like, clamp down on whatever it is.
No, I
And
wish it was that, but it's not,
mm,
right? It's not about self control. No.
right, because obviously people try that, right?
Yeah,
I
I
mean,
I saw people try that to the point where they had anorexia. Like, I mean, they went as far as you could, and people passed away from it. So, like, i- it's not about self control. So, yeah, and I
right.
think that just like metformin, self care is not sexy either. So,
Mhm.
but it really comes down to until we have more research helping us understand how to help. I would encourage anyone with PCOS to really think about what could you add to your life instead of what you could take away.
Great place to end. I love that. And, do you wanna tell folks where they can find you? Obviously on Substack. Is there any other work you wanna,
No,
highlight?
Substack is the best place. It's basically my social media. I do have a podcast that's going to be ending soon, but if you like more on the complicated history with food, it's called Find Your Food Voice. And I also have a book on that. And in that book, it's there's 5 different people that share their experiences, and 3 of them have PCOS. So if you do have a complicated history with food and you have PCOS, it's written for you.
Great. It's Find Your Food Voice. Do you happen to have it on your desk right with you?
No, but I have a lot behind me.
Oh, yeah, I see. Oh, I love that.
I
I
have
know I should have mine right here too. I didn't have my props prepared.
yeah, me neither. It's okay.
It's okay. Um, great. Well, Julie, thank you so much. I know this is going to be helpful to this parent who asked and to everyone else who's listening. And I'll be sharing the recording. So might be seeing this later. Thanks so much, Julie. And
Thank you.
just thank you for the work you're doing.
Oh, you too. I'm so glad that we connected.
Yeah, me too. Okay. Take care.
Bye.
Bye.